somebody who grew up with several chronic illnesses. I was diagnosed with juvenile arthritis when I was an infant, so I've kind of always been a patient and involved with patient communities. I wanted to go into healthcare to help, so I became a human factors engineer and actually a PhD academic researcher in environmental medicine, studying patient-centered outcomes. On the professional side, I then was interacting with all these people who were trying to make things or do research to improve the patient experience and genuinely wanted to help, but they weren't talking to patients. So to me that was odd, because as somebody who identifies as a patient, I just knew that there were things that they were missing. Quite honestly, I'm very open about sort of my patient story, and people knew I was a patient, so they'd say, "Hey Jen, will you serve as a patient on this committee or this project?" And at first I was flattered, but then as time went on and I kept getting asked over and over again, it really signaled to be an access problem. I am one of 54 million Americans with arthritis, and so to be that sole person working on these various arthritis initiatives seemed like a problem as somebody who is white with a PhD and lives in New York City. And that can't possibly be representative. So I started to just kind of play matchmaker with my own community. It was really the patients that signaled that, oh my gosh, I want to share. I never knew anybody cared. And that's when I was like, wait a minute, they want to talk to the patients and the patients want to share their stories. So to me, it was kind of an obvious thing that we needed was just a better way to connect the two sides. Savvy Cooperative, we're actually a patient-owned co-op, which makes us a little unique. So we're collectively owned by our patient users. And we provide this platform that helps to connect companies and innovators directly with the right patients and caregivers. Our vision for the world is one where the people who are creating and providing insights, input through data or otherwise, are fairly valued and have equity in what they're helping to contribute. Savvy is really setting out to restore the power balance in favor of the patients, to make sure they really have a voice and are looked at as equal partners in healthcare innovation.